It's a little something about COVID-19. So we turned into a pandemic last March. So a pandemic is essentially an epidemic of disease that spreads across the country, across multiple countries and continents. For instance, the Spanish flu from 1918 to 1920 infected over 500 million people back then and killed over 50 million. Obviously, modern medicine was not what it was today. And there was a very high incidence of death with that. Swine flu, which we did encounter just about 11 or 12 years ago, infected about up to 20% of the world's population. Really did not kill as much as COVID-19, and that's why some of us don't remember it as a very deadly virus, but there were still 500,000 people that died from that. And then in December 2019, there was a virus isolated in Wuhan, China, that was causing a mysterious illness, a respiratory virus, and within a couple of months spread to multiple parts of the world. And that's really where the World Health Organization declared a pandemic last March. And many of us remember that day. And it was likely to create a pandemic leading to multiple deaths across the world. So the name of the virus, many of you, if you've been tested for COVID, you see SARS-CoV-2. That's because we had a SARS-CoV-1 about 20 years ago in Asia. That did not spread like this current COVID infection has spread. So that was the first one that we saw 20 years ago, really was contained. And the current pandemic is caused by SARS-CoV-2, which is a severe acute respiratory syndrome coronavirus 2. Really, COVID-19 is the name they've given for the disease caused by that virus. So there are many viruses. The common flu is a virus. And again, COVID-19 is the disease that we see caused by this new virus that's come about since December 2019. So to put into context, this is data from about 2 days ago that's most up to date. Globally, we've had just under 140 million cases of COVID-19. There have been just under 3 million deaths from COVID-19 thus far. Obviously, that's still going on. We are not past this pandemic yet. In the US alone, we're over 30 million cases and over 500,000 deaths just in our country. And realize it's just over 1 year. So those are numbers within the first year. Will likely go up over the coming months as well. Thankfully, not as fast as it has gone up in the preceding 1 year. So what are symptoms of COVID-19? So common symptoms you can see here: fever, dry cough, body aches, fatigue, loss of sense of taste and smell is very common, especially in younger populations. Headache, congestion, sore throats. Some people have diarrhea or abdominal pains as well. The thing to realize is that these are symptoms many people experience for a variety of reasons. So not all of these means you have COVID-19, but if you're experiencing any of these, it's a reason to contact your physician, discuss what your symptoms are, and see if it's worth getting tested for COVID-19. Really, what I tell people is early identification is the most important thing. People do fairly well with COVID-19 if they recognize it early and they treat it early. If you kind of ignore symptoms for a period of time, go 1 week, 2 weeks, and still having symptoms without getting checked out, very often that's where we run into some issues. What are some more severe symptoms of COVID-19 or some of the complications? People can have chest pain, shortness of breath. There have been multiple reports of stroke and heart attacks, as well as other blood clots that occur with COVID-19. Again, these are not common, but these are potential complications from the virus and the reaction to the virus. There have been individuals with organ failure, respiratory failure, pneumonia. And then in rare cases, there have been reports of multi-organ inflammatory syndromes that they saw in children. Again, I want to emphasize most children do not get very sick from this virus, but there have been reports that some may develop this inflammatory process that goes on. So the great majority, I should say, have mild symptoms, like a common cold, essentially. and most people improve without any treatment anyway. There are some people who are asymptomatic. Early on, they were reporting asymptomatic spreading of the virus. And that goes on to say why it's so important to wear masks, even when you're feeling fine. You know, it's not only if you're coughing that you should have a mask on, it's the idea that we could be carrying this virus and spreading it asymptomatically with no symptoms. And therefore, that's an important reason to keep those masks going, at least for the time being, until we hit some sort of herd immunity and we know people around us are safe. Severe symptoms often need hospitalization. We were discussing earlier, you know, we know a lot more now than we did 1 year ago. So, you know, in New York, we felt it hardest, most likely, as opposed to the rest of the country. You know, other parts of the country had waves that came on and got hit harder later in the pandemic, but we were the first ones, and we really were in the dark. You know, the doctors did not know what was going on in terms of how to treat this best in the early stages. And we've come such a long way in a very short period of time. So even those with severe symptoms, if they're seeking treatment early enough, we could get them treatments that do help and do hopefully help prevent the need for intubation, mechanical ventilation, where we breathe with a machine for the patient instead, and hopefully avoid deaths that are preventable. You know, risk factors for severe illness, elderly is probably the highest on the list. You know, the older the age, the higher the risk for more severe illness. High blood pressure, diabetes, obesity have all been recognized as risk factors. So there's many people that are, you know, aren't getting these treated well or haven't realized that they have these underlying conditions. Also highlighting the importance of seeking regular care with your physicians and a lot of your family members, perhaps, as you know, most of you are college age, so you're not dealing with many of these issues. But if you have family members who haven't seen the doctor lately, that's an important reason to get in, identify those risk factors or anything that might be going on. If the sugar is high, the blood pressure is high, and get those treated before they get sick, because that does make a difference with how that illness goes for them. In terms of treatment options or prevention of severe illness, so there's multiple things out there right now. You know, I would say of all the treatments we have, the best one is really what we call monoclonal antibodies. And that's something that's been developed since the beginning of the pandemic, where they're giving essentially antibodies to a patient who has not seen the virus before, but now is sick with the virus. They have to be given it within the first 10 days of their illness. And it's only certain groups that qualify right now. That, you know, there's not an unlimited supply of this. So they do have to allocate it more to those higher risk categories, many of which fall into what we just discussed on the previous slide. But I will say, asthmatics, anyone with asthma who takes a daily inhaler qualifies to get this. Anyone, again, high blood pressure, morbid obesity, age over 65. And there's some other indications as well I didn't put here. But for the most part, this is another reason why it's so important to identify the illness early. You know, if someone's not feeling well, get tested right away, because if they test positive, their physician may figure out if they qualify or not to get this treatment that prevents people from getting worse. This is not a treatment if someone's already in severe illness. If someone's already developed pneumonia, there's other treatments. This is the one thing we've seen that really prevents people from getting to that severe stage and is most effective early on. So if someone has symptoms, they get tested immediately. If they get this in the first 3 days, from my experience, within 48 to 72 hours, their symptoms are almost entirely gone. So really, I would take this as one of the take-home points of what's most important as a possible treatment option that not a lot of people realize is available. In terms of other things, vitamin D, there have been multiple studies showing vitamin D helps in terms of preventing severe illness. Vitamin C and zinc are very important for immune health. And there's just a study published this week talking about how regular exercise has been shown to prevent severe COVID-19 infections. So hopefully all of you have been keeping up with your exercise, but if not, it's a good time to get back on it, as it might be a good way to prevent severe illness. I wrote remdesivir and steroids on this slide because remdesivir is an intravenous medication we give for patients with more severe illness, usually with pneumonia, that are hospitalized. And then steroids is also something we've used for hospitalized patients, as well as some patients that haven't been hospitalized that have persistent symptoms that have been going on for some time. Anticoagulation is blood thinners. As I mentioned earlier on, some of these patients are at risk of developing blood clots, and that's where blood thinners come into play to help treat those blood clots or sometimes to prevent them. And then the last thing is really vaccination. And this is, one of the success stories of the last 12 months is, what normally takes 10 or 15 or 20 years to develop a vaccine, we've been able to develop in a very short period of time. And not only develop it, but develop a vaccine that's highly effective and safe. So right now I listed all three. As some of you may have heard this week, the Johnson & Johnson vaccine is on hold in the US. We have two other ones that have been approved in the US for use. It's the Pfizer and the Moderna vaccines. Again, so Pfizer has been approved for anyone over the age of 16. It's two shots to the arm, 3 weeks apart. And then the Moderna is anyone over 18 years old can qualify. And it's 2 shots 4 weeks apart. And again, it usually takes 2 weeks after the second shot to recognize that full immunity. That's what they've found. Johnson & Johnson was initially approved under emergency use. And obviously, they continue to study all of these vaccines for a period of time after they've been released. And what they saw was there was a few cases of unusual blood clots in some patients. And I'll get to that in a future slide. And that's why they put it on hold, because they really did want to investigate that and see, is this more chance or was this related to the vaccine potentially? So to explain some of what goes on behind at least Moderna and Pfizer's vaccine, these are a new class of vaccines. In the past, vaccines took either a live virus that was dulled down or a piece of a dead virus and injected into us, and our bodies developed a reaction to it to help us fight future infections related to that. mRNA vaccines are a new type that really help us fight those infectious diseases, but it's done differently. We're not putting a piece of the virus in us. The mRNA vaccine really is injected into our bodies. It teaches our body to make a protein that's on the virus itself. And that's when our immune system builds antibodies to fight that piece of the protein, so that when our body gets exposed to the virus that has that protein, now we can suddenly recognize it, our body can fight it, and we don't get ill, or at least not severely ill. Benefits of these mRNA vaccines, like all vaccines, is protecting patients so that we don't get very sick when we get the virus. So again, this kind of goes through that a little bit. This is a nice slide because it goes piece by piece in terms of how it works. So the first step, the vaccine is given, the Pfizer or the Moderna is given in the arm. The instructions, that mRNA goes inside of our immune cells. The cells then make the protein piece. After that protein piece is made, the cells break down the instructions and get rid of them. So those instructions, that mRNA vaccine is gone after it's created that. Next, the cell displays the protein piece on the surface. Our immune systems get ramped up as it recognizes a protein that doesn't belong there. And that's exactly how our bodies develop antibodies to those proteins. At the end of the process, our bodies learned how to protect us from a future exposure to that virus. As we learn about mutations, many of us hear about mutations. We have South African variant, the Brazilian variants. These are all mutations they've seen that come from different parts of the world. And as the pandemic moves on, we may see more and more of those. Those are changes in certain proteins on the outside of the virus itself. So what we recognize is that, there may be a time if we find that Pfizer and Moderna no longer are effective for certain variants, they might be able to create an mRNA vaccine specific for those spike proteins. And that would be like essentially a booster shot for us to protect against those variants as well. So what are some facts about COVID-19, the mRNA vaccines? they do not use any live virus. So someone cannot get sick from getting one of these viruses. There is no live COVID-19 in any of these viruses, in the vaccines. They do not in any way affect our DNA. You know, some people were talking about how mRNA goes in and changes our DNA. That's not the way it works. It never enters the nucleus of the cell where the DNA and the genetic material of our bodies is made up. And the cells break down and get rid of the mRNA as soon as it's finished using the instructions in this one instance. So those are some things that we often hear about. There's a lot of misinformation out there, and I think it's important to, you know, correct people when they make the wrong assumptions about these vaccines. So who should not get vaccinated, at least from the mRNA vaccines? Anyone who's had a severe allergic reaction, or even if it was not severe, anyone who's allergic to any of the ingredients in the COVID-19 vaccines, anyone who after getting the first shot got an allergic reaction should not get the second shot either. And then again, an allergic reaction is considered anyone who was treated with an EpiPen or was told to go to the hospital after they got the vaccine. So mRNA vaccines in general are safe, effective, and reduce the chance of severe illness. We have 2 of them approved under emergency use right now in the United States. Amazingly, you're talking about 90 to 95% effective at reducing severe illness and approximately 100% effective at reducing death from these viruses. These are incredible numbers considering the yearly flu vaccine that many of us get on a good year is about 70% effective. So we have to recognize these are very, very effective vaccines. And as I mentioned earlier, as they've been giving these, there have been, you know, over 30 million of these vaccines given so far. They continue to watch to see if anything comes up in terms of adverse events, anything dangerous going on. And both of these have held up the test of time so far. Most adverse events from vaccines we see in the first 3 months, these have already been being studied since last summer. So we're talking about going on 9 months or so of data that they're looking at. And again, millions and millions of patients. So what are normal vaccine side effects? There's pain, redness, swelling in the injected arm. Those are very common. I got the Moderna vaccine just because that was what was offered to me. I can tell you after the first vaccine I got, I certainly had about a day and a half of soreness in my arm. So if you have a big tennis match, probably not a good idea right before. But you know, you might want to time this at a time when it would be okay to have a sore arm. Again, other things that you might experience: fatigue, headaches, muscle pain. Some people do develop fevers for a few days as well. And these are normal side effects to the vaccine. These don't mean you're having an adverse event. They're actually a good sign. It tells us that your body is creating an immune response, creating antibodies so that you can fight a future infection. And again, the majority of these effects subside within 2 to 3 days. To talk a little bit about Johnson & Johnson, this is a viral vector vaccine. So that's when there's a piece of the virus, not a live virus, but a piece of the virus that was injected into the body. The body creates an immune response, more similar to traditional vaccines that we're aware of. In clinical trials, the Johnson & Johnson was about 66% effective at preventing illness. And again, a high efficacy at preventing hospitalization and death. So even with Johnson & Johnson, it really did limit, it did prevent hospitalization and death in a great majority of those patients. What happened with Johnson & Johnson? You know, it was released under emergency use. We had about 6 million doses given in the US at least, when there was about 6 reports of unusual blood clots, something called thrombotic thrombocytopenia. And it's currently on hold just because the FDA is really investigating to see whether these truly are vaccine related or not. I want to remind people, this is why they continue to study these. So I'm happy that it's on hold. We have to let them go through everything they need to go through to figure out if this is truly something to pull this off the market or not. But realize there's 6 cases in 6 million doses given. You're still talking about a 1 in a million chance of a rare event happening. The chances of hospitalization from COVID-19 itself are much, much higher than that. Even when you go into a healthy young population, I myself have had numerous 25 and 30-year-olds who are otherwise healthy in the hospital for 5 to 6 days because of this virus. So, the chances of getting very sick from this are way higher than that 1 in a million of a rare side effect. Nonetheless, it's on the FDA to really investigate this and see if they truly are going to continue using it or not. Future vaccines, AstraZeneca, also on hold in Europe. It's not approved in this country at this moment. They're currently investigating reported blood clots from that vaccine as well. And there's a Novavax vaccine also in stage 3 trials here. So we'll wait and see. There's various different vaccines throughout the world right now. Different countries are using different vaccines. I would say our country is ahead of the game in terms of being able to vaccinate a big part of our population. So why get vaccinated, right? So a lot of people come to me and say, well, I'm young and healthy. Why do I need it? I'll just get the virus and roll the dice. And that's true, potentially. But you have to realize you also have to protect the people around you. Many of us have elderly family members at home. And the vaccines, we got to wait and see if we really prevent transmission of the virus. But from what we're seeing is that there might be a decreased transmission of the virus as well. So if you have elderly family members at home, anyone in a high risk category at home, you have teammates, coaches, athletic training staff, there's a lot of people we're interacting with on a daily basis that it's our duty to really try to protect them. And that happens with not acting irresponsibly with our interactions, continuing with masks, using good hand hygiene. But vaccination does play into that as well. Other thing, lowering the strain on hospitals and healthcare systems. Our healthcare system in New York was really pushed to the brink last March and April. So we don't want something like that happening again. Thankfully, our hospitals are doing well right now. Our numbers are down in terms of COVID hospitalizations. So I'm hoping that only continues to go down, but realize these are our actions impact all of the people around us and really the society around us. So we have to be aware of that. And then the last thing is really protecting yourself. Like I mentioned, vaccine adverse events are very rare. Risk of hospitalization is higher than the risk of those adverse events. And we have to keep that in mind, that there is a greater good in all this. And again, the more people are vaccinated, the sooner we'll get this pandemic behind us. So we all want to get back to normal. And we all remember what last February and last January were. We don't want to stay in what we're in right now. So we really want to do our best, work together to get through this safely, keep everyone around us safe, and hopefully have a good season next year when we're all playing sports together again.